Hi, I'm Dr. Mieke. I'm an OB-GYN with Cascadia Women's Clinic in Vancouver, Washington. Today I'm going to talk to you regarding body changes in pregnancy. Some women experience extreme back pain during pregnancy, and if this occurs, usually if you try Tylenol, heat, such as a heating pad or a warm compress, you can also use a masseuse and get a massage. And also a chiropractor. All of those can potentially help relieve your back pain. Another thing that may help improve your back pain is the use of a body pillow, and that's one of those long pillows that essentially stretches from your head down to your toes. And sometimes that helps to relieve the strain. The last thing you may want to try is a maternity belt, and those sort of look like weightlifters belts. But what they do is wrap around your tummy and they help support your tummy so that your back isn't straining to do all the work. Another common complaint is around ligament pain, and that happens in your growing area, and that can happen on one side or both sides. And that's because as your uterus grows, because baby's growing, those ligaments and muscles are pulling or they're stretching, and that can cause pain. For some women that can be very severe. Again, you can use Tylenol, you can use heat, massage, a chiropractor, and all of that should help to relieve those symptoms. Other symptoms that women may experience are hemorrhoids, and that's just because constipation is a big problem with pregnancy. And so once you develop a hemorrhoid, what you can do is to use different over-the-counter items such as witch hazel pads, which may help to relieve the symptoms. The big thing that we need to do in order to decrease the development of hemorrhoids is to be sure you're eating a well-balanced diet that includes lots of fiber. And so if you're not getting enough fiber in your diet, then what you should add in is Metamucil or some sort of other over-the-counter medication that will help loosen your stools and also to help you have softer stools. Also with hemorrhoids, you need to be drinking at least 100 ounces of water a day, because the more water you drink, the more that allows your body just to kind of flush and pass things through. This holds true as well for constipation. So if you're having issues with constipation, you need to be increasing your water, eating a well-balanced diet with fiber, and fiber can be found in green leafy vegetables. And also to be sure, if you need to, you can add in something like a Metamucil type agent. There's also over-the-counter stool softeners that you can use as well in order to help relieve your constipation. Sometimes later in pregnancy, usually in your third trimester, once your tummy gets out to once your tummy starts to grow up to your breastbone, some ladies will start to have issues with heartburn. That's very common because the uterus has gotten so big, it's pushing up your stomach. So your stomach capacity becomes smaller. So at that particular point in time, the acids are coming back up and then causing your heartburn symptoms. With the use, the heartburn symptoms, you can use an over-the-counter antacid. And any of them are typically fine during pregnancy, just to be sure to consult with your healthcare provider regarding that. Other things that you can do when you have heartburn is to be sure that you're not eating less than 2 hours before you lay down. So you really need that time period in order to allow your food to digest. If you have other questions or concerns, contact your healthcare provider regarding any of these symptoms.